Is your collarbone very prominent? So let us know from Dr. Prathamesh Jain about acromioclavicular joint dislocation, what type of injury it is, how the patient can present to us, and what are the treatment options which are available at present with us.
So it's basically a small form of dislocation in the shoulder, but it is not the shoulder dislocation. We call it as an acromioclavicular dislocation. By that, we mean that there is a bone which is called as a collarbone right here, and this pops out on the top and becomes extraordinary prominent, which looks very bad, ugly, that is a cosmetic disappearance, and it will be painful also in some cases. So that is called as acromioclavicular dislocation. Now, why that happens is because there are two sets of ligaments which are called as a conoid ligament and trapezoid ligament. These are basically coracoclavicular ligaments, starting from the coracoid and going up to clavicle. When these two ligaments are torn, the clavicle pops up, and this is called as AC dislocation. It's not a very serious injury, it's sort of a mild injury, and most of the patients of AC dislocation can be treated without surgery. So I would not advise surgery for all patients of acromioclavicular dislocation.
So, what kind of patients will require a surgical procedure?
So, if there is a very small kind of a dislocation, so it can be grade 1 and grade 2 and grade 3 onwards. So, grade 1 and grade 2 injuries in which there is a little bit of dislocation, that is okay, and you don't need to do surgery from them. The only residual problem that the patient will have is little bad cosmesis. This bone will be problem. So, most of these patients can be treated without surgery. And I would just recommend an arm pouch and a cuff and collar sling or a strapping, something like that. And most of the grade 1 and grade 2 AC joint dislocations would not need a surgical intervention. Only those patients who have grade 3 or more, grade 4, 5 type of very bad dislocations, bone which is very prominent, and this problem which is associated with pain. So pain along with poor crossmesis or a odd looking prominent clavicle, only in those cases I would recommend a surgical treatment. So approximately if 100 patients come to me, around 70% will be conservative, non-operative. Only in 20 to 30% of the patients I would be advising a surgical treatment.
So the surgical treatment also depends on the basis of the presentation, whether the patient presents acutely or whether he has an chronic.
So again, acute presentation, type 1, type 2, no surgery. You just have to put arm pouch. Type 3 and onwards, if the bone is very much prominent, you can do some surgeries to reduce it and provide a splint that would lead to the coracoclavicular ligaments healing. So there are many kinds of surgeries that we can do for grade 3 and above.
So what are the different surgical
So there are many options. You can do grossly, if I can talk about, is arthroscopic and open. You can do it open or you can do it arthroscopic. If you are doing an arthroscopic, you can do what is called as a dog bone technique, in which you apply one button down, one button up, and then we tighten it with fiber tape and clutch. Then we do a technique which is a metal-free technique also. So there is a fiber tape and clutch which is tied around the coracoid and over the clavicle and tensioned so that the clavicle is resting down. That is again one technique. And then there is a infinity loop lock technique, which is also there is basically a more thicker sort of artificial graft that we can use. So many techniques, and you can do it both open and arthroscopic. The results are almost similar, but if you want minimal invasive, we can do it with an arthroscopic technique also for the reduction and stabilization of the AC joint. And then you have to use both the horizontal component and the vertical component. So both the coracoclavicular ligaments you have to, and acromioclavicular ligament also for the anteroposterior stability.
Sir, there was a implant called as a hook plate for the clavicle. Is that recommended in this?
Nowadays we don't recommend it because this will only lead to mechanical block. It will not lead to the coracoclavicular ligament healing. So it is absolute. There was a screw which is called as Bosworth screw. There was a plate which is hook plate. These are all absolute treatment. Nowadays we no longer use it.
So recently we use the ligament
either buttons. For acute cases, either buttons or fiber tape and clutch with a locking tape.
And what will be the rehabilitation protocol following
Usually,
this
these
surgery?
patients need to be put on an arm pouch for a period of 6 weeks.
And after 6 weeks, we can start
Yes,
the
yes.
mobilization and all.
Yes. The chronic ACL, chronic
Yes.
AC joint dislocation. So, chronic AC joint dislocation are basically those cases which are neglected. The patient had an injury like 1 month or before, and the patient is now present with a residual deformity. So, these chronic AC joint dislocations are very difficult to manage, and these patients ideally should be treated with supplementation or grafting. So, there are two surgeries that we can perform for them. The first surgery, which is called as a graft. So we can do a coracoclavicular ligament reconstruction. For that, we can use either gracilis or hamstring graft or like a Yosemite graft. Pass underneath the coracoid through the tunnels in the clavicle, and we try to recreate the conoid and trapezoid part of the coracoclavicular ligament. So this is for the chronic ACL. And if the patient doesn't want to use a graft, we can use an artificial graft which is available nowadays, which is called as an infinity loop lock tape. This is from Kairos. This is basically a polyethylene tape which is braided. So the tissue usually ingrowth into that, and this can lead to a very good result in long term. So if the patient is not willing for the grafts, actually anatomical grafts, so you can use an infinity loop lock tape. And in some patients in which the patient's age is more and the pain component of the AC joint is more, we can do a procedure which is called as a Weaver Dunn procedure, in which we can excise a little bit part of the lateral end of the clavicle. So we remove around 8 to 10 millimeters of the lateral end of the clavicle, and we do this procedure for either grafting or infinity loop to stabilize the acromioclavicular joint. So that can also be done if the AC joint is bad and the patient is more painful. So that is again for a sort of a chronic case.
Thank you, sir. So, viewers, Dr. Prathamesh sir have enlightened us about the acute and chronic AC joint dislocations and how to treat them and how we can manage them successfully. So, if you are nearby, you have any patients with such kind of injuries, you can contact us and we will be happy to help you.